Oh, down here we have another method, which people should know about. A guy by the name of David Scadden came up with this out of, I believe, Harvard. And he presented this in 2010 at the stem cell meetings in Boston. And I don't think many doctors around the world have paid attention to him, but I was there and listened and paid attention. And I've been using this technique ever since, and that's using, Neupogen is a compound that is used by doctors, oncologists, when they're treating cancer patients. And what they do is they give this material as an injection for 5 days, and on the 5th day, they take the person's blood and a lot of it, they run it through what's called a leukapheresis machine, and they take all of your blood and separate all the white blood cells out, and out of those white blood cells, there's a lot of stem cells, because the Neupogen releases the stem cells out of the bone marrow. What am I supposed to point at?
Just anywhere.
Anywhere.
Anyway, down here we have, so for 5 days we do this. Now, what I've done is, the Scadden described was that if you do the Neupogen for 5 days, and then if you wait for 2 weeks after the Neupogen, what happens is that during that 5 days, the Neupogen releases your bone marrow stem cells, but there's, I describe the bone marrow as having 2 layers. The superficial layer is the stem cells that are active every day, making red cells and white cells and all that. But the bone marrow has, in the basement, if you will, stem cells that are not active and not doing anything. And I call those stem cells virgins, because they're not doing anything, nobody's touched them. They're pristine, and the reason why they're pristine is the body wants to keep them that way, so that if you ever need to be repaired, the body's got a template that is perfect, as perfect as it can keep. And those cells are deprived of oxygen pretty much your entire life, so they don't have any oxygen, they don't have any mitochondria, they just sit there going, okay, I'm here, but that's it. And so when you do this Neupogen business, and you throw out all the other stem cells, those cells go, oh, it's time to wake up and go to work. And so what they do is they start to proliferate, and so within 2 weeks, those virgin stem cells have proliferated, and you get 5 to 10 times more stem cells in your bone marrow than you had to start with before the Neupogen. So not only do you get better cells because they're smaller, more pristine, but then you get 5 to 10 times more stem cells by doing this process than if you don't do it. Now, what's the difference clinically? Well, the difference is, and I'll tell you, I've taken people like with Parkinson's, and you do a bone marrow on a person who's, say, 7 years old without Neupogen, just take a bone marrow and do it, you get no results, nothing. Okay? You put them on the Neupogen for 5 days, bring them back in 2 weeks later and do another bone marrow, and voila, now you have great results. Big difference. Okay? So it's true that this works, and it's a really decent and great therapy to use. And so we do that on a fair number of patients, especially now with our ALS. We do a lot of it with our ALS patients because we do that. They do it at home. They come in 2 weeks after they've done the treatment at home, the Neupogens. They come in, we do the bone marrows, we culture their cells, we get tons of brand new, fresh, healthy stem cells. We grow those, we get lots and millions of cells, so we can get 150, 200 million of their tiny, pristine cells that we can then give them into their cerebrospinal fluid to stop this terrible disease. Okay. As part of this, everybody in Youngering, if you will, has been hearing about senolytic agents and senescent cells and all that. And it turns out that, as just a quick review of that telomeres, and we see telomeres, where do we see telomeres? There, telomeres. These little gadgets, these little caps on the end of the chromosomes. These are telomeres, And every time this is a cell, and the chromosomes of a cell, when that cell divides, these little chromosomes get a little bit shorter, and so these telomeres are the end caps of these chromosomes, and every time you replicate, these chromosomes get shorter and shorter until you no longer can replicate. And that takes about 50 to 60 replications for that to occur. When that occurs, when you get to 60 replications, that cell no longer replicates and it just sits there and does nothing other than poison you. And so that's called a senescent associated secretory proteome, which is a whole bunch of cytokines and whatnot that actually cause inflammation of your body. Part of the aging process is inflammation. And as you probably, any of you who are getting older you may have noticed that you're getting inflammation of this joint or that body. What is this about? And this is part of that process of the inflammatory process. So you have wear and tear that causes it, you have autoimmune processes that cause it, and you have this senescent secretory associated proteomic type of process going on with aging. And so if you could get rid of all those, you would have no more inflammation, no more pain, and we'd all be a lot happier, at least. I would like to, if we could do nothing else, we'd go through our 75 years without pain, that would be amazing just right there, I think. Because otherwise, why are all these people taking opiates and killing themselves every day? I don't think they're drug addicts. I think they're trying to stop having pain. And so if we could somehow eliminate all that pain, that'd be fantastic. And so one more step there, as far as stress is concerned, stress affects all of these telomeres and telomerase and all that. So each, we might think of these are all, our whole body is made out of the same cells, and so therefore they're all aging the same, but that's not true at all. What we're doing is we're aging preferentially. So if you're drinking today 3 or 4 glasses of wine, your liver is being stressed. If you're smoking, your lungs are being stressed. If you're eating hot, spicy foods, your gut is being stressed. And all these stresses cause problems in terms of the telomerase and these telomeres. And so if you have no stress, then of course that's not so good either. So it's like, what do you do? But in any case, you can kind of get an idea that, for example, emphysema is a good example of how this effect causes problems for people. And that is, if you go to your doctor, you've been smoking for 30 years, and you go to your doctor, he says, oh, I think you're getting emphysema, you better quit. And you quit, and you say you're 50, and within 5 years, now you have full-blown emphysema. And why is that? And part of that process of getting worse after you stop smoking is because the stress that you did killed or damaged so many of the lung cells that they no longer can replicate and can no longer repair and regenerate your lung tissue. And so that's an important concept. So you want to, but there's another factor there is that most doctors don't know that when you have emphysema, early emphysema, there's been some changes in your lung that prevents your body from getting rid of the bugs. And so you have this chronic, low-grade chronic infection going on too, and most doctors don't know that and don't treat. And so in general, if you just put them on antibiotics like tetracycline, that can stop that whole process, or at least obviate or mitigate it quite a bit. And so there's a lot of mental practice going on in this world, right from the top on down. Okay. Age-associated diseases are complications arising from senescence. What am I pointing at? This is what
You're using the laser.
You're pointing the laser. You're pointing the laser. You press the other button.
The arrows.
The arrows.
Arrow to the right.
There you go. Try.
Okay?
There you go.
Yes.
So what am I, with, okay, I got the arrow, so am I
Yes.
pointing at you?
All right.
Is
You
that
don't
where
have
I'm
to
pointing?
point
Sure.
anywhere.
Anyway.
It's good.
So we have 100,000 per day die of age-related causes. So there's a lot of people dying out there of age-related diseases. That's going on. Let's back up. Okay, NAD, that's kind of like one of the hot new topics, and this is the last couple months now, if you haven't seen it, NAD levels are helpful for new blood vessels, or not blood vessels, but helping the blood vessels stay healthier. Now exactly how that works, I'm not so sure. They claim that it's, the NAD drops as we age, but with increasing the NAD, you can take that 500 milligrams twice a day. Life Extension sells a product that has that in it, and they're claiming that helps with keeping your blood vessels. Okay. Anybody on NAD right now? They had a, there you go.
They have
I mean, how long you been on it? How do you feel?
Yesterday I got one shot, sorry.
You started yesterday?
Just one injection I got yesterday. I felt
Oh, an injection. You know, that's, well, we've had some limited experience with it. We got really tough cases, and so we're struggling always trying to help these tough cases. And so I heard about NAD a year or two ago, and so we got some and we tried it with Parkinson's and ALS, and instead of running 6 hours, we had to go 12 hours. Started at 8 in the morning, 8 at night. Long, long day for everybody, and it was just really, really difficult and didn't do much of anything. And so we kind of said, we're going to wait for somebody else to do it, as far as, for the old people with lots of medical problems. So our success has not been good with the injectable, and so I'm more curious about oral.
Okay, I'm glad you said that. I have friends who've done it, and only 50% of them have actually felt any improvement, and some of them actually have felt really worse after the IVs of the NAD. So I'm wondering, is it conclusive? Is it the benefits of the NAD IVs? Is it final and conclusive? Some people don't feel anything, some people actually have an adverse reaction, and some people have a really profound reaction.
I'm Phil Milgram from the NAD Treatment Center, and that's what we do. We have 8 people there right now that are getting an IV infusion. Yes, it does last a long time because you have to get enough of the medication into the patient. You have to use the right NAD at the right dose. You have to accentuate it with other compounds like N-acetylcysteine, for example, that help create new circuits in your brain. You have to avoid other things that damage the NAD. But we've treated hundreds of patients over the last 5 years, and there's an incredible difference in many disease entities and in reversing aging.
Are you going to be talking here about it?
I talked yesterday.
Yesterday.
And so have you got any statistics, I don't know what kind of diseases you treated, could be all kinds, so anything specific that, I deal mostly with neurological conditions.
Right.
And addiction is kind of that, and I can appreciate it working in addiction, but I'm concerned about, chronic
Right.
Parkinson's, Alzheimer's, ALS, MS, that kind of stuff.
We've treated all of those diseases. We've had many great improvements in Parkinson's and senescent brain disorders. And there's some Parkinson's patients that didn't respond. I don't know if there's different types of Parkinson's and seizure disorders. Tremor disorders and things like that. But we have changed people's lives with NAD.
All right.
But that's why I have 7 RNs and 3 LVNs, and you have to, it's a whole way of practicing that is different, just like your setup.
Sure.
You know, nobody can replicate what you do. You need to have the proper, system in order to put that person in. I'm sorry.
Okay. No, thank you very much, I appreciate it. And my time is up. And so thank you very much for coming to my little shtick, and come and visit me up in San Francisco. And I have a booth out here.
You will be out there?
I'll be out there for a while anyway. Okay, thank
Are
you.
you here for the rest of the day or tomorrow or?
I'm trying to be,
Hopefully.
yeah.
All right.
I don't know how to
We'll
get
lure
out of
you to
this.
stay.
How do I get out of all this stuff?
You can just, I mean,
Go
I
to-
come back
To the back.
and then you can.
Felix will help you.
Oh, thank you.
Feel it. Can I get another round of applause for Dr. Steenblock? Wow. Really insightful. So welcome back, everybody. Thank you so much for coming, and yesterday was so incredible. And as I'm sitting here listening to that last talk, I was just reflecting on the audience as well, and many speakers are here in the audience. And what a beautiful opportunity for these brilliant minds to come together and share, and I can feel such an openness between you all. It's a conversation that's really happening here that's really inspiring to witness and to be a part of. So thank you all for participating and showing up. And this is the first time that BioRegenesis is here, as we know, so it's just a big celebration for new beginnings. So I host an event locally here. I started it about 2 years ago, and it's a speakers event. And when we first started, we had maybe 15 people in the audience, maybe 20, and now we do it every month, and we have a consistency of like 80 to 100 every month. And so things just start to catch on, which is really why I wanted to share that. This is a beautiful beginning of a place, and I have a very good feeling that this is just going to continue to grow. You guys think so?
Yes.
Yeah,
It's a
definitely.
movement.
It's a movement, definitely. These are really important topics. So I'd love to hear from you guys. So, most of you guys are so incredibly informed and educated, and I would imagine that you're learning more as you're here. So would anyone like to share a little bit about something that may have come up yesterday, or something that impacted you, or something that you learned yesterday from one of the talks? And if no one raises their hand, I'm going to call you out. Garnet?
Not yesterday, just now, with Dr. Steenblock.
Do you want to get a microphone? Or?
No, it's okay. I've got it. The thing that, although there's a lot of great stuff in the presentation, and maybe it's because it's an interest of mine that you'll see, I'm speaking at 12, neuroplasticity and so on. The fact that when you're doing these therapies, and the doctor pointed this out in numerous ways, introducing the agent may not be the complete action. And what you saw is that he would use different techniques to signal, you could say a stressor or a signal reinforcement, so that when the agent was introduced, there was a reinforcing or complementary action. Because to me, the point is, get the action. The agent can be variable, but the endpoint action is what you want. And I believe, I think I know, but I believe that knowing how to get the body's attention to the agent helps the agent take the action. And that's what I got in, that in his one-day protocol. You saw a few different ways that basically he is creating a positive stressor so that the agent is signaled into action. And to me, that is at the bottom of a lot of things. Okay, so that's what I got from just now. I'm very pleased that I showed up at 9 o'clock because I've met him before. He's got a lot to say, and he's local. So that's it.
Great, thanks for sharing.
Yeah.
Beautiful. So much, there's so much.
I just have something to share about a product I wanted to tell you about. I just submitted a paper for publication on a study I did. It's called Benagine. It's oxaloacetate, which is in the citric acid cycle. and it increases your NAD. It's an oral supplement. I don't know if you know about it. Alan Cash, it's his company. He's here in Sydney. Do you know him?
Yes.
Okay, so anyway, I just want to say that's a really good, easy to take supplement for people.
Great, thank you so much. Beautiful. So more conversations to be had. What a gift it is to get to be here in celebration of these new ways of being and interacting. Okay, so we are going to be rolling into another amazing lineup of speakers today. We have, I think about 7 speakers today, which is going to be really beautiful and full and very dynamic. So I don't know if you guys got a chance to look at the lineup, but there's some really incredible speakers coming this morning and then also this afternoon, and then we have a panel planned for this evening, and then we're going to go into a gala where we can dance it out and party and have fun. So we got a lot in store. So before we get into that, I want to make a couple of announcements. So who here is definitely going to the dinner tonight? Awesome. Okay, who here has their wristbands? Okay, awesome. A couple of you. The rest of you guys, make sure you get your wristbands at the registration table. If you have your receipt, great, bring that. Otherwise, I think it's the ticket. So if you have your ticket, go up to them and then they'll give you a wristband. And I'll give you a little reminder.